So as I'm sure everybody has heard, Michigan now has its first presumptive case of monkeypox. Monkeypox for the last couple of months has been sort of spreading through the world. There's a little over 5,000 cases now, a little over 300 here in the US, and now in 27 states plus Washington, DC, Michigan being the 27th. So far, what we know is pretty minimal. There's one person, they tested positive presumptively. It's been sent to the CDC for confirmation. They are isolating away from others, and so don't pose a danger to people around them, and seem to be, from what I can tell from the statement, doing reasonably well, not hospitalized or anything along those terms. We don't know anything about how they might have caught it, whether it came from outside the state, or anything along those terms yet. I'm sure that will be forthcoming in the near future.
Dr. Sims, can I stop you for a second? I think you're leaning on the table and you're shaking.
Sorry?
Thank you. Like, our TV folks will appreciate.
No problem. You muted, Tammy. I couldn't hear.
Okay, go ahead. I'm sorry to interrupt.
Oh, that's the major thing we know about the case here in Michigan. As I'm sure everybody also knows, the announcement was just recently made in the last couple of days that there's going to be a release of the vaccine from the national stores to the states most affected by this at first, and then outward from there. They're expecting to release about 50,000 doses in the very near future, and then 300,000 doses shortly after that, and then over 1 million doses by the end of the year. This is the Jynneos vaccine, which is it's more typical of the vaccine, the vaccines that we're familiar with, the old smallpox vaccine and the current smallpox vaccine that they have, and they expect also protects against monkeypox. Is used the two prongs, and the people who got vaccinated with it in the past would develop a pock mark on their shoulder. This is not that type of vaccine. This is more of a typical vaccine. It's 2 shots. It's injected subcutaneously. And as far as I know, you don't get a pox mark from it, but we haven't really used it very much because we haven't had the need to. As you also probably know, monkeypox is a pox virus, just like smallpox was. And we were very successful at eliminating smallpox using vaccination. So we expect that this vaccine will work and be very protective. They're going to focus on people who are at highest risk, and then potentially move out from there. Exactly how large this vaccination program might get in the future is sort of hard to know. But that's where things stand right now.
Thank you for that, Dr. Sims.
Sure.
Can you tell us how worried should people be about catching monkeypox?
Yeah, this is not another COVID. That's the most important thing to get across, right? We're coming off COVID still. COVID is clearly still out there. And so everybody's worried this will be the next thing, right? COVID started out as a few cases, and whatnot. But this is different. It doesn't spread the same way. It's not nearly as contagious. It really spreads by contact. So contact with the lesions that you can get, the rash, or occasionally if they have lesions in the mouth, it can spread through large respiratory secretions that only travel a short distance. But the primary mode is contact. Now, this particular outbreak has been spreading through sexual contact. It's not, strictly speaking, a sexually transmitted disease like HIV or syphilis, which is spread because it's in the semen, it's in the vaginal secretions. This is still contact. It just happens to be contact during sex. And it's primarily been with men who have sex with men. So frequently the rash, if it appears, has been, in the areas affected around the anus and things like that. And so it's been a little atypical, and this is not the way it's typically spread in the past Monkeypox has been around for a long time. Obviously, it's mostly been found in Africa, but we've had outbreaks here in the US. We've had imported cases every now and again, and we did have the outbreak almost 20 years ago now, where Gambian rats, which is one of the hosts that it's found in nature, the animal that it's found in, were imported by an exotic pet store. The rats infected prairie dogs in the pet store. The prairie dogs got sold to local kids who got infected, but that was rapidly figured out and controlled, and it didn't spread much further. Now this has been spreading. Obviously, it's in many countries. It's all over the world, but it's still to date only about 5,000 cases, but it has potential to keep spreading, obviously. But again, because of the route of spread and how that it's not really that contagious a disease comparatively, we don't expect it to get completely out of control the way a COVID did or the way flu does during flu season. But it's important that we take precautions to try to get this under control as soon as possible.
Thank you. And with that, let's open it up to questions because I'm sure there are a lot of them. The first I see is WZZM. Did you have a question?
Yes, I did. I wanted to talk a little bit more about the smallpox vaccine. So just to clarify, the vaccine is going to be distributed and there will be a program as a preventive measure.
Yeah, so as I said, we don't know all the details about exactly how they're going to distribute it. They said they're going to distribute it to the 10 most affected states. Now, does that mean most affected by, case rate? For example, Hawaii is not in the top 10 states. They're just below the top 10 states, but they have a much smaller population. So do they fall in the top 10 for this program? I don't know those answers. As far as I know, those answers haven't been released, exactly which states are going to get it first. But really, as I said, they're not focusing on a sort of a widespread vaccination campaign because most people are not really at risk of getting this. What they're focusing on is the high-risk population, healthcare workers who might get exposed, men who have sex with men, contacts of the people who have tested positive, things like that. I don't really expect it to become a huge, everybody gets vaccinated sort of program. But we are keeping our minds open for what may come in the future, but nobody's really expecting that to be needed.
I did have a couple follow-up questions. If you've had the smallpox vaccine, are you already do you have some sort of protection? And
yeah,
is there a booster for it?
Sure, that's a great question. That 20 years ago, when there was that last monkeypox outbreak, at first they were only allowing people who had been vaccinated against smallpox to take care of those patients because there is expected to be some cross protection. Now, it's been a long time since the last person got vaccinated against smallpox. I was in one of the last years of when they were giving it to all the kids in the US, so I've been vaccinated. But my younger sister didn't get vaccinated because they had stopped the program by then. It's been a long time since I was exposed to anything, that might make those antibodies come back up. That being said, the memory should still be there. 20 years ago, they did some testing and it did indicate that that people did maintain memory even that far out. Now it's been another 20 years. But there are no plans, as far as I know, for a booster shot at this point. But it's a great question: is do people who have been vaccinated, 50 years ago, do they need just one shot, or would they need the full series? And we don't have the answer to that. My guess is they probably, if somebody who had the vaccine that long ago was exposed or is at high risk, they'd probably be given both shots.
And
if you could, when you ask a question, after you ask the question, if you could mute yourself, that would help because then it doesn't bounce to you with the video. Thank you. Go ahead and ask your next question.
And then Do we know if Michigan is getting the vaccine?
I would guess not. The announcement of the vaccine coming out predated Michigan's first case. It happened about 24 hours before we had our first case. And so we're certainly in the lowest positive states. So I would guess, New York and California are certainly going to be on that list. After that, I don't know exactly which states will get it. And New York and California, as I'm sure you know, have the highest number of cases in the country right now. But I would doubt Michigan would be on the first group to get it. But if we need it in the future, I'm sure we'll be added to the list.
Thank you, Dr. Sims. Justin, I see you had your hand up.
Yeah, thank you. So 2 questions. What should folks look for to see if they may have monkeypox? What are maybe the symptoms or what should they look out for? And how do they prevent getting it from someone else who might be infected around them?
Yeah, so great questions. So the symptoms of monkeypox, they start out sort of generic: fatigue, muscle aches, swollen lymph nodes. The real key feature of monkeypox is the rash. It's sort of a blistering pustular rash. Usually it was over the entire body, really, and you would get really large swollen lymph nodes in the neck and whatnot. This version of monkeypox seems to be presenting a little differently in some patients, where the rash is really frequently localized to the area of contact, like in this case, the anus, as I mentioned, because it's been spreading in men who have sex with men. So you may not see the rash the same way. So doctors have to be very aware when they're speaking to a patient who might have it, and know that it doesn't present in the classic way always. So that's that's sort of what to look out for. In terms of protecting yourself, again, it's spread by contact. So if somebody has it, if somebody in your household got it, for example, it could potentially get on surfaces, it can spread through contact. So cleaning appropriately is going to be important. Isolation, the person who has it should isolate. Obviously since this is being spread through sexual contact, condoms will offer at least some level of protection. Exactly how much is hard to say, because it's not, as I said, spread through the semen. It's spread through actual skin-to-skin contact. And condoms don't prevent that completely, but they may be helpful in reducing it.
Thank you. And as a follow-up, do all cases have the rash show up?
I'm not 100% certain. I think there's at least some degree of rash in most of the cases so far. I hesitate to say all do, because there's always exceptions in medicine, but my understanding is most patients are getting the rash, but it may not be the typical rash. It may be much more localized.
Got it. Thank you.
Thanks, Dr. Sims.
Of course.
Karen Bouffard, you had your hand up, Detroit News.
Yes, hi. I was just wondering if there's any similarity with chickenpox, or is it just two totally different diseases?
That's a great question, and it's one of those things that is confusing to people. Chickenpox is actually not a pox virus. It was named chickenpox because of the blisters, but chickenpox is actually a herpes virus, so there is no real similarity between them.
Thank you.
And then I'm sorry, just one more question, if no one else
Of course.
has one at the moment. I'm just wondering, like what the incubation time is for it, and if there's any asymptomatic spread.
Yeah, that's a great question. The incubation time is sort of days to weeks. It's sort of typical for these kind of viruses. It usually shows up, within about a week to about 3 weeks. In terms of asymptomatic spread, we're not really sure. It's hard to know. Testing has been limited up till this point, so it's hard to know if there are people out there who just sort of get it but never have any symptoms. Just like, remember, in the beginning of COVID, we had that same exact question: was there asymptomatic spread? And it took a while, even with the sheer number of cases we had, to really figure that out. But that's a great question. And even a sort of a related issue is, there's, because testing has been fairly limited, there's potentially people out there who have the symptoms and have not been tested because it's difficult to get the testing, because doctors aren't used to this and don't immediately think of testing for monkeypox. I think that will change over the next months. There's been a lot of effort made into making it easier to get the testing, and of course, educating physicians, and everybody's starting to hear about this now. But here in Michigan, for example, before this, with no cases, a doctor might say, well, why should I think about monkeypox? We don't have any here yet. Now I think that people will start to become more aware here in Michigan and throughout the states as it does potentially spread further. When you start to see something, that's when doctors really start to think about it automatically.
Thank you, Dr. Sims. Karen, are you all set?
Yes, I am. Thanks very much.
Mm-hmm.
You're welcome.
Ann Runkle, you had a question?
Okay. Dr. Sims, I'm curious, can you explain why men who have sex with men are at a greater risk, and those who engage in heterosexual sex, if it doesn't have anything to do with bodily fluids, if it's all about skin-to-skin contact, would you have the same skin-to-skin contact no matter who your sexual partner was?
Yeah, so, that's a great question. And, there's a couple of potential reasons. Anal sex is more likely to cause small tears in the skin and whatnot than vaginal sex is. And it may have something to do with that. And it just may be that that's the population it sort of got into, that somebody, got infected, in some, through sort of the more normal contact with an animal or contact with another person who had it. And for whatever reason, this strain is more apt to spread sexually, and it just got into the population. Remember, with HIV spreads through both heterosexual and homosexual sex. But it started out in that population, and it took a little while to really get out of that population. And we may see the same thing here, that it started out there, and it's spreading there, but it's spreading not just in homosexual men, but in bisexual men, and so it does have potential to jump out into the heterosexual population. Certainly, it just really hasn't as much yet.
Thank you, Dr. Sims.
Of course.
If I may ask another question, this is Ann again.
Sure.
Do people die from monkeypox?
That's a great question. Classically, there are different strains of monkeypox. This seems to be one of the milder strains where there's not a lot of death associated with it. Some of the worst strains had up to about a 10% mortality. But you have to take that with a grain of salt. Remember that it was primarily spreading in sort of rural Africa, where there's not a lot of healthcare available. So it's hard to know just how deadly it is, in an area where there's more available healthcare. But so far, there doesn't really seem to be a mortality associated with this outbreak, not in any major way.
And you may have already answered this then, but I couldn't hear everything you said. Are you more at risk if you have traveled extensively then?
Travel potentially exposes you to areas where it's more common. But travel seems to be how it's spreading from area to area, right? So it started out in Europe, and so people who traveled to those areas were more likely to be exposed, but they weren't highly likely to be exposed. A lot of people traveled to the areas in Europe where there was monkeypox. Most people did not get monkeypox. People who traveled there and potentially got exposed to a sexual partner, or somehow another exposure to somebody who had monkeypox, they were the ones who were at risk. And the risk was certainly higher there because that was where it was circulating. But travel in and of itself is not so much a risk factor. It's just whether or not that travel brings you into contact with people who could spread it. Does that make sense?
Yes, it does. Thank you.
You're welcome.
Does anybody else have any questions?
I actually have one more question.
Sure.
Can you tell me if somebody thinks that they've been exposed or they want to get the vaccine, what should they do?
Yeah, that's a great question. You know, obviously, the emergency rooms at the big academic hospitals are, you know, sort of preparing for this. Probably the emergency rooms at the smaller hospitals are preparing for this also. Contacting your local health department for what to do if you think you may have been exposed is probably your best bet. Most of the patients who get this don't need to be hospitalized. You know, they can be treated as an outpatient. And for the most part, the treatment is supportive care, though there is a drug, tecovirimat, which is an antiviral that seems to be have activity against it. Again, it's been approved via animal models and whatnot, but it really, because this has not been an issue, hasn't had a lot of human use other than for safety trials. So we know it's safe to give to people, but we don't really know how effective it is in humans. We know it's effective in animals and such. And that has not really been released from the national stores yet, as far as I'm aware. But the health department is probably going to be your primary contact to find out where to get tested, how to get tested, whether you're eligible for the vaccine at this point. In the future, that may change. But you know, when there's a new disease on the horizon, we tend to work through the health departments first until, you know, we can spread all of that out to the health systems, to urgent cares, et cetera, et cetera. So right now, the health department's probably your best first contact.
Thanks a lot. Thank you.
Of course.
Any other questions? Well, I think with that, we're all set. I appreciate your help, Dr. Sims.
Of course.
Thank you for sharing your insight and expertise with us and with the media of Southeast Michigan, West Michigan, and up north also.
Happy to.
Have a great day, everybody.